So as you've started to hear about this morning, many workers in Oregon don't have access to earned sick days, which means many workers are going to work sick. Many low-wage workers are choosing between paying their bills or going to work sick. Many parents are choosing to send their sick kids to school. You don't have to be a nurse or a public health professional to know that that's not good for the public's health.
I'm a retired registered nurse. I worked in nursing for 27 years. I was 17 years a parent in Portland Public Schools. And for me, this is both a women's rights issue and it's a personal, it's the right thing to do. People shouldn't have to choose between paying their bills, keeping the roof over their head, and not getting fired. And I think really at the basic level, could we all agree that you shouldn't get fired if you call in sick when you go to for calling in sick when you have the flu?
My name is Ann Berry Lever, and I'm testifying on behalf of Oregon Nurses Association and Nurse Practitioners of Oregon. I'm addressing the committee as a primary care provider with over 20 years of service to my patients. And my focus today is to advocate for patients to understand what pregnancy services they are receiving. This bill is a common sense step to offer clear information and protect the privacy of women like my patients during what I consider is one of the most vulnerable times of their lives.
My name is Meg Portwood, Chairman Roblin and members. Thank you for allowing me to talk. I'm a family nurse practitioner in Lincoln City, Oregon. I have been there since 1976. Yes, and I work in a primary care clinic. I am a designated rural health clinic. Our goal is to provide primary care to our patients. We see pregnant women, infants, complex problems, birth to death. And in order to keep myself in practice, this rural tax credit is critical.
I'm not sure that I can afford to go into primary care and do the things that I'm learning and care for these patients the way that we're being taught to, and still be able to pay for my student loans. So I just like to thank you in supporting Senate Bill 440.
We've been dispensing for 18 years very safely. It saves money for the patients, and it's very convenient, and it can actually prevent worse infections. For example, if a patient has a urinary tract infection, we can give them the medicine there and not delay treatment, and that prevents them from ending up in the hospital with a kidney infection.
This bill, differently, only applies to NPs and PAs in primary care and those providing mental health services, and who bill under their own name and national provider identification number. The policy is straightforward, at least in our opinion. Private insurers would be required to pay the same amount when the services are billed using the same codes as physicians.
This isn't about decreasing psychiatrist pay. It's about fairly reimbursing nurse practitioners who provide adequate services and skilled services to rural communities and urban communities.
I am also in the process of opening a satellite clinic in Talent, Oregon, a rural community, and it's interesting to see the differences between what's happening in the urban areas and the rural areas. And I think the consideration of the matter before you is of extreme importance in both areas, perhaps more in the rural areas.
I saw that there was a number of residents that were leaving the area because they had to be closer to health care as they aged. And so when I completed my nurse practitioner program in 2003, I opened an office to help meet this need. And this office now serves over 2,500 people. About a year ago, we almost went bankrupt. We've had about 15% cuts to our revenue from some of the insurance companies, and it's made a big impact on this office.
Finally, my practice took about a 25% cut from a couple of insurers about maybe 2 years ago. That's been significant for me in that I don't see as many complicated kids.
I'm hoping that with parity we can keep primary care nurse practitioners and physician's assistants in a position where they can continue to provide the care that they have been, and to develop new sites and new individuals who are interested in continuing to provide that care.
I would love to go into primary care, but House Bill 2902 is one of the ways that I can assure that I know I can afford to support myself. I think it's just important to recognize that we need primary care providers, and nurse practitioners are one of the ways that we can get primary care to patients that don't have it and don't have access to it. And I really hope that you would consider passing House Bill 2902 in order to ensure that future cuts to nurse practitioner reimbursements are not allowed.